sex, regardless of our race. They can have an impact, a significant impact on us. And as you can see, when we look at these things that basically look at your health outcomes, healthcare, no offense to doctors, they're great, they take care of you. That only, has only about 20% impact on your health outcomes. The rest, the 80% of them are all of these, right? And these basically, and when you think about these behavioral health outcomes, are basically some of the most important things that lead to your health outcomes. Dr. Torreira talked about earlier on, if we can all stop smoking or we can stop drinking, right? Drinking, smoking, unhealthy diet and all of that, those have a huge impact on your health outcomes. And guess what determines these things? Your social determinants of health, exactly. Right? Have a huge impact on these things, whether you smoke, whether you exercise, whether you drink. I can, choose, I can want to exercise after work, for example. But if I live in a neighborhood where I'm worried about getting shot if I go run outside, exactly. I'm not going to go run, right? And so those are the kinds of things that we think about that have a huge impact on our health outcomes. And so what are, to just dig deeper a little bit in terms of thinking about these social determinants of health, so what are these factors? So your economic stability, do you have a good job? Are you employed? What is, what kind of employment do you have? Are you working at a McDonald's where, if you take time off to maybe take a sick child to work, that you're losing pay because of that, because maybe you're on hourly pay, things like that. And will this job, does it afford you the kinds of things, the lifestyle that maybe is necessary for you to have a healthy living? Neighborhood or the physical environment we live in. So we already talked about it. Do you live in a neighborhood where you have access to parks where you can exercise, or clean environment? My first job at the health department some years ago, my first very big project, we were told these people who live near the landfill that had closed for a long time, was a very politically sensitive issue, and I was told, this is your project that you're going to first interact with, and these are people who are basically they couldn't get out of that place. They live within a radius of this landfill, and they're having respiratory problems. Mm-hmm. And so that also is a social determinant of health. Education, so what is your level of education? So, and obviously our level of education affords us access to maybe better paying jobs or better information. If I don't know anything, I can call Dr. Terrell because I know him, and maybe I'll get some useful information that I can use then to live a better life. Food, do we have access to food? Now we have areas in our, if you take St. Louis as a case study, there are places that are referred to as food deserts, right? Yes, where you do not have access to grocery stores, and even if there's a grocery store, that aren't the fresh fruits and vegetables that we need to live a healthier life. And so these kinds of things. Our community, do you live in a community where there's shooting all the time? And so what kinds of things? And then healthcare access. Do you have insurance to be able to access your doctors and things like that? So all of these combined are called social determinants of health that really have a huge impact on our health. And so right here, they are basically the same things. They are also these social determinants of mental health, unemployment or underemployment, food insecurity, the built environment. There's in fact a study that just came out recently out of JAMA that talks about neighborhood factors contributing to your mental health outcomes, right? And so these are things that really have a direct impact on our health outcomes overall. So if you think about social determinants of health, so what are sort of the causes of them? You can see on the left hand side here, so governance, right? Who are these people who make our ordinances for us to have 10 liquor stores in our neighborhood? Right? So those are governance issues. Like these are the people we vote for and make these rules. And because, as you all know, some of these things, there are some neighborhoods with a lot more liquor stores than maybe parks, right? So those are social determinants of health. Social policies, public policies, and cultural and social values are these people who basically, what's the culture of that neighborhood? You know, you live in some subdivisions where there are rules and all of that, where you get your letters from the HOA, you know, in terms of mowing your lawn and all of that. All these things have a huge impact on us. And if you look at people who tend to be most affected by these basically social determinants of health, minorities, people with disabilities, people who live in inner cities or living in rural areas, obviously have highlighted immigrants here for obvious reason, persons with chronic illnesses, and persons born into poverty. And also, there again, poverty is a key determinant. Have very, very severe consequences for our health and ultimately our lives, so leading to basically premature death for us. Socioeconomic needs that is correlated with poor health outcomes. And I show you a map here that maps basically the social health equity index need. And the darker shades that you see on that map there are basically where the need is greatest. So if you know them, because most of us here are from St. Louis, I've lived in St. Louis day of my life when I worked at the health department, so I've memorized a bunch of these zip codes. So you can see the zip codes up towards the northern section of our regions, the St. Louis region, is where the greatest need is, right?
Yes, sir.
And that is where basically, I'll show you a bunch of maps later on in this talk, where you can see that's where the greatest need is, and so that basically tells us maybe that's where we need to invest resources for us to be able to address some of these social determinants of health. Obviously, in terms of, so when we think about social determinants of health, socioeconomic status is a very, very important factor, right? So which is it's very highly correlated with these material conditions that are for individuals and communities that lead to their well-being. And when we think about these, the social determinants of health, we can't say, okay, they directly impact your health outcomes. So they affect your health outcomes indirectly, in a sense, right? So, for example, less education and lower income, so people in the lower income strata or with lower level of education are more likely to smoke, are less likely to exercise, are less likely to consume, you know, these fruits and vegetables, fibers, the healthy foods that will keep them healthy. On the other hand, people on the higher level of, on the higher end of education ladder, or higher, which by definition also almost will mean that they are on the higher end of the income level, are less likely to smoke, are more likely to engage in exercise, are more likely to consume fiber, right? And so these are things that improve their health eventually. And as you can see, also these things that are related to social determinants of health, adults with lower level of education and lower level of income, as well as their children, are basically at higher risk for nearly every risk factor of this, whether it's smoking, whether it's lack of exercise, whether it's engaging in risky behaviors. And then adding insult to injury, when there are natural disasters or these man-made disasters and all that, these tend to have a very, very particular impact on people who are on the lower end of the socioeconomic income end. So as you can see, I put the picture of the people that, I don't know, some of you might not have been here during Katrina in 2005, and so you can see the people who suffered the most were the people on the lower end of the socioeconomic income. And so you can see this is basically, again, adding injury, sort of injury, basically, these are the people who are impacted the most by these social determinants of that. Because when the information went out that, you know, a hurricane is coming, the people had means left. They got on planes, they got in their cars and left. And the people who were stuck there were the people who were basically trying to get on buses to get out of there. And so that's what you see there. So people in these areas, and I have another map in the report that shows that people in those areas tend to be diagnosed at a much later stage compared to people in this one. And people are not getting, because people are not getting screened. So again, here is another good example of screening being really, really, really important for us to, for our health outcomes.
But also I think using the previous data that you provided, which showed there was more people insured on that area, meaning even after it was diagnosed, the access to treatment was also higher than these people in the West County that even after it was screened or found, they had access
to treatment. And so, right, maybe you don't have the knowledge, maybe I don't want to take a whole day off from work and all that. Some people can go see the doctor without necessarily taking a day off or losing pay, right?
Yes, sir.
These people who are on salary, whether you work 500 hours or you work 5 hours, your pay is probably the same, right, for some of these people. And so these kinds of things really have a particular impact on us. And even when we were talking about stress earlier on, you have a sick child and you need to go pick them up from the school and you need to take them. Now, if you have to worry about how many hours am I going to work this week, that adds a whole other level of stress to your life than just the child being sick. So you have other things to worry about just instead of just your child. We also look at breast cancer mortality here by neighborhood poverty level. You can see again, the very high neighborhood poverty areas tend to have the highest rate of breast cancer mortality. And when we look at it by breast cancer mortality by race, black women were 2 times more likely to die from breast cancer compared to white women. And then over there we're looking at prostate cancer. Prostate cancer, black men were about 2.4 times more likely to die from breast cancer, from prostate cancer, compared to white men. And so all of this slide, because it also speaks to a question of access to healthcare, right? And so as you can see there, so by age, we've broken this, the mortality, breast cancer mortality by age. So you see 35 to 24 to 44-year-old. So basically the ratio there for black-white ratio is about 3.2, which is high, right? And then for 45 to 54-year-olds, it's about 2.2. For 55 to 64, about 2. And for women 65 years and higher, it's about 1.2. Basically negligible, right? Healthcare is really, really, really critical here. And so you can see after 65, really the differences are taken up. So the insurance becomes a really, really important issue for us. And so that really COVID turbocharged it in a very, very big way. And people started to think about, okay, what do we really mean by social determinants? You can see here even in, during COVID, we saw obviously black African American tended to die at a higher rate from COVID-19 than the rest of the population. Again, you also look at it by neighborhood poverty level. Again, areas in the basically very high poverty level neighborhoods tended to die a lot more from COVID-19.
That's crazy.
Yeah. You can expect to live up to about 87 years.
Okay.
Versus if you live about 7 or 8 miles up the road in Berkeley, where the health department is, you can only expect to live up to 66 years. So that gap of about 20 years in a distance of less than 10 miles. And so what is that? So you're getting the drift, right? And then even when you look at COVID, what happened in COVID during COVID-19, so I think the CDC came up with a report at that time that so life expectancy overall in the United States went down, I think, about 1.5 years as a result of COVID. And then we took that same analysis and boiled it down to our St. Louis County, and we broke it down by race. You can see black African American women lost about almost 4 years